Good afternoon, and today I have a very special guest. She's actually my colleague, Emilia Del Pino. She's a speech and language pathologist, but in this conversation, we're going to talk about her treatment. I'm so thankful what she is willing to share the treatment, what she got through for treatment of her sleep apnea, and also we address some dental pathology. And I hope this interview going to be interesting for our colleagues, but also for people who consider combination of orthodontic treatment and sleep apnea treatment. And of course, it's not a picnic, and I really appreciate what Emilia gonna share that with us. So Emilia, please tell us, why did you go through a year and a half of that treatment and what it was like?
Well, thank you for having me on your channel and offer me the opportunity to speak about our journey together. What really took me to see you and seek you out after meeting you and listening to many of your podcasts was initially some dental crowding and concerns of tooth decay. So that was primarily the issue. It was not cosmetic at all. I was really okay with my smile and my occlusion, but that was the first precipitating factor. But then it became more apparent that my sleep was really a problem. I was diagnosed with moderate sleep apnea, and I was struggling with all of the symptoms: daytime fatigue, kidney issues, snoring, so dry mouth. Those were the initial concerns. Later on, I discovered that I had some other issues with saliva testing that came back, which was part of your comprehensive care. So those were the initial issues that brought me to you. But then I also knew, as far as myofunctional therapy, I had some signs and symptoms of mouth breathing, clenching. I saw some gum recession. And with that, I thought there were enough red flags that I'd like to have addressed. And then I approached you for the consult, and we started working together.
Those are really, that a very special trust. I take trust of my patients very seriously, but to treat the colleague, that's really an honor. So you had a combination treatment. I don't know, I want to tell my audience what it was. It was a clear aligner therapy to correct the position of your teeth. Yes, we talk about crowding, prevention of the root decay, but another idea, what I had in mind, I want to make your arches wider to have more space for your tongue, during the day and during the night. And yes, you had oral appliance therapy, which looked similar to that, but also had expansion screw in the middle to accommodate clear aligner expansion, what I programmed in. But another part of that treatment, that's all form. I was trying to correct the form, dental form, and then, we can say sleep form. I moved the jaw forward to make airway bigger during the night, but we also talk about functional. And you, being sleep and language pathologist plus myofunctional therapist, and you giving a course, so you are a very knowledgeable person. But when you are patient, we have to share our knowledge with you. So you had 3 sessions of myofunctional therapy in our office. I would like to ask you, what changed from the moment you start to now? You've been in treatment for a year and a half.
Well, I think now my oral rest posture has habituated. Before, it was very much a work in progress, and I had to really work on doing the exercises, monitoring myself, thinking about my oral rest posture at rest, look at my swallow patterns, and make sure I wasn't using any compensatory muscle movements, which I was. And those were the 2 big things. Aside from the myofunctional exercises with chewing and swallowing and oral rest posture, I even needed to go back a couple of steps before that and think about postural stability, alignment, and diaphragmatic breathing. I certainly needed some clear directive instruction on how to do that and feedback. It's very different when you think you're doing an exercise or a movement pattern a certain way versus someone having an objective observation. And that's what I had with Maryanna. She was amazing. I actually thought maybe I just needed one session. And that's where, you need to be open. And I certainly was open to feedback and learning. I thought, okay, I could just get a couple of quick pointers, but there was really more involved, especially because she works with adults, and problem solving different challenges that I had. If I wasn't successful with doing something or carrying it over, she had the critical skills to say, okay, let's backstep and try this and get back to me. Share your feedback. A lot of recapping of what my experience was so that we could make progress together. It was very much a joint effort and a partnership. It was really great.
I really like how you put it, because it's always a partnership. Like, people very often, then they hire, professional speech and language pathologists, myofunctional therapists. They would say, now I trust you. Now you do it, but it never works. It has to be the partnership. We equal partners, and yes, it's true. Doctors have accountability privilege. We hold the patient accountable and we monitor the progress. So that's, I really love how you put it in your collaboration with Maryanna. So I really hope all my patients have the same vision. But now I want you to share your real feeling. It was not a picnic to have clear liners. Yes, clear liners, they are not thick, but they apply the pressure. And then to sleep in oral appliance, which has a significant thickness on top of moving the jaw forward. So can you share with our audience, is it doable, or what challenges you have to overcome to make it work?
Well, I would say the first part was making sure I had myofunctional intervention before even starting with the aligners. So to practice what is correct oral rest posture, what do you need to have in place for proper nasal breathing, and interventions that might be simultaneous or happening before. So the ENT appointment was instrumental in looking at what does my airway look like, what obstructions are there. I discovered I had a moderately deviated septum. What's nasal regimen going to look like in nasal care? So all of those steps play a critical component on success in any intervention with myofunctional therapy, and then the aligners and oral devices. So I would think, those are important pieces. It was hard initially for me to adjust speaking with the aligners. There was a little bit of, saliva management was challenging. But with time, I was able to use the aligners to help navigate getting my tongue after some exercises in a proper alignment inside the aligner. So I thought that was actually helpful. What we did before the oral appliance came in is you recommended doing an over-the-counter sleep appliance, so that I was becoming accustomed to something in my mouth that was big and bulky at night. And that certainly was an adjustment. I remember taking it out in the middle of the night multiple times. And we worked together to soften it, realign, do a new bite with it. So a lot of what we did together was trial and error, and your interest in what's my experience, what is my unique experience. So how do you feel about that? What do you think? And you certainly gave me options and direction, but ultimately you said, Amelia, this is your body. You need to figure out what will work for you. I have some options for you, and you need to think about it. You need to trial, and let's work together to come to something that you feel is right for you. So that initial process of doing a little trial with a sleep device to just get accustomed before using the aligner and my custom oral appliance was instrumental. In conjunction with continuing with Maryanna with the orofacial myofunctional exercises to work on lip strength, to keep the lips together so that when the appliance was in at night, I was able to close my lips partially because it was a little large, but I still worked on those muscles, and we worked on what type of taping would work for me with this appliance. And that took time. That was certainly something that took time in conjunction with what intervention was I going to use to help with nighttime breathing, whether it was the intake, the nasal cones, nasal rinse with the neti pot. These were all components that were layered on. So it could be overwhelming. Certainly, initially it was, and we had to kind of talk it through and problem solve. But for me, when I started to see that my sleep was a really good sleep, I began to dream. I wasn't waking up in the middle of the night. I felt rested in the morning. I didn't have that foggy headache. I only needed 1 cup of coffee in a day, and you're just energized. Like, I would come to places and people would say, wow, you're glowing. Well, I feel really good. I had a great night's sleep. So all of those aspects, we did have to, go through some trials and kind of figure out and problem solve things. But when you see the benefits, for me, it was something I was very much invested in because I did see the progress.
No, but it's so beautiful how you put it. I can appreciate more your approach. I remember the challenges, and I remember, when you face the challenges, it's never a pleasure. It's never a picnic, but it's nice how you look at it. Yes, it's a partnership. You come, I'm going to give you the options, and you choose among the options. So now, can you share with my audience, and I like how you put it, it's not one thing, it's everything. It's clear aligners, and your teeth look straight now, and oral appliance, and you have restorative knife, but also nasal regimen, and we have to go through taping options and through nasal remedies options. So what's your regimen look like now?
Right now, I brush in the morning, and I do an oral rinse, a probiotic oral rinse. And I'm eating and drinking, considering my oral rest posture. Right now it's very inconsistent that I say, I have to remember to close my mouth. That just seems to have habituated well. My swallow pattern is a standard swallow pattern now. I'm not using compensatory muscles. In the afternoon, I do another oral rinse. At night, I put the clear aligners back in. Until I get my permanent, I have a new inner in the appliance that I'll be using, and then at night I take a prebiotic for my
for the oral gut health,
and oral health. So that's my regimen.
But for the nose,
I do each night a neti pot rinse, and I'm
with
using.
saline?
Yes, with saline, yep. And inconsistently, depends if I'm feeling stuffy, then I will also use the mute nasal dilators. So those are not used every night. Those are mostly used if I feel like a little stuffy. I think that's pretty much my, yes, the Airs cream goes on the mute before I insert. And we work together to work on the size. And then if I'm out and about, I have the nasal breathe right strips, but I didn't find that as effective.
What about taping? Do you use tape right now?
I do use tape now. Right now it's just a small piece. So before it was a larger piece. And I had to also work through some of that, the different tapes that I liked, Was I going around the lips or one horizontal or vertical? Right now I'm feeling I like the one vertical. And it actually, the beauty of how I've worked on my breathing and all of my functional skills is that I'm not taking off the tape in the middle of the night like I was. So that's always great when I wake up in the morning, well rested, and then I'm taking off the tape in the morning versus it coming off in the middle of the night.
Thank
So
you
it's
very
a
much.
lot of little things.
A lot of little things. So you, not only you work on your muscle habits, but also, people take off the tape because they feel, we can call it oxygen hunger. They cannot live with CO2 concentration in the blood. They want to get more oxygen. And it's not a wonderful thing because nose is for eating, nose is for breathing, mouth is for eating. But you slowly but surely be consistent and work on it, like to have a goal in mind, you actually have a success.
Yeah.
So thank you very much for being such an amazing patient, and we really appreciate your openness to share your story, and we really appreciate you being such a devoted patient. Thank you, Emilia.
Thank you, Dr. Sokolina. It was a pleasure.
Thank you.
Take care.